But I want to take a quick moment to introduce Alex and why we've brought him here to speak with us in the PX community. So, gosh, Alex, it was over a year ago. Somehow I came across a protocol. Say that for me, Protoqual.
Yeah, but I accept all pronunciations of the company.
That's good. But I had found it, so I reached out to you to find out a little bit more about what you were creating. And so I'm going to read just a little bit that we put in the description for the event, but then Alex is going to tell us so much more. So I'll read that just briefly, and then I'll give a very short abbreviated of Alex's bio, which you can read more about. But Alex, you've done so much. You've had such a wide, diverse career. And then I'm going to hand it over to Alex to show us a little bit about what he's created and how they're using it. So Protocol PX provides an innovative solution that augments your PX improvement efforts. Protocol PX goes a step beyond our traditional survey efforts, taking feedback from your survey provider and delivering targeted education to improve performance in the areas where you need it most. Combining patient feedback acquisition with short video lessons validated by PX experts. Training is tailored to the needs of your organization and staff. So that just tells a little bit about what enticed me about what you created, Alex, and you're going to show us more. Let me tell you briefly about Alex. So Alex Altman is the Chief Operating Officer at Protoqual, where he manages business development, direct corporate communications, and supports a diverse and dedicated team of innovators. So they're using people from across the world, which I love. It's global. And in this, you said 5 time zones around the world. So there's quite a few people who contribute to what you're creating. What I also love is Alex has authored 2 books on private education for Random House, developed educational content for the Princeton Review, and served as editor of California Business and Public Policy Journal. So and that's just a little bit of what Alex has done, but with education, that's what I love. You've really blended some of your educational background into what you've created. And so I am really happy to share with you today, to introduce you to Alex, have Alex show you what he's created. And then once he's finished his presentation, he says it's going to be about 35 to 40 minutes. He does welcome questions throughout. So as he's showing something, if you would like to ask, either put it in the chat, I'll monitor that, or raise your hand. We're happy to have you actually ask the question yourself and have that dialogue. But then there will be time afterwards for some Q&A and some discussion about the tool itself, perhaps how you're seeing the applicability of it in what you're doing in your organizations. And then finally, I do hope that you'll join us after the event for the additional 30 minutes of speed networking. But Alex, right now, I am thrilled to hand it over to you. I'm excited to see this product because it's been quite some time since we've spoken.
Yeah, thanks so much. And thanks everybody for joining me today. I tend to get a little stage fright in these types of environments, but what I found is that the people that are in the community involved with patient experience are in general about the easiest folks to talk to you could ever meet. And so a lot of that nervousness always just kind of goes away. And so what I thought I would do, I have some slides that kind of organize my thoughts in advance of a demo. And then I'll walk you through the product, kind of what a learner is seeing, and then maybe a little bit of the functionality of what a leader can do in Protocol. And then I attached a kind of a couple slides of a case study at the end to kind of show you some of the results. And I thought I might just start by just spending a minute saying, why Protocol came to be. I don't know if this was in I'm going to share my screen. I'm not great at multitasking, but I started Protocol in the pre-COVID days with a group of physicians, and full disclosure, one of those physicians is my father. I'm not sure if that was in the description. He's a retired gastroenterologist and a medical director. And so I had background in education and in public policy, but my mom's an NP, my sister's an NP, and my dad's a gastroenterologist. So all we talked about was healthcare. And so at a certain point, about 5 years ago, we were talking about what we identified as some of the ways that we could maybe help in the universe of patient experience. And I was kind of thinking more from the perspective of a patient, but my father had experience both as a practitioner and as an administrator in an IPA. And we kind of had several ideas that we thought were that were fertile ground for being able to help out healthcare organizations. And I guess on the data side, we really feel like you have a lot of PX scores, and many of them are quantitative and numbers, but really those numbers reflect thousands of interactions between human beings. Mm-hmm. And Protocol is really about helping those human beings to be better equipped to improve those interactions. And it might be patient and physician, but it could also be patient and office staff. It could be organizational leader and physician, we wanted to create ways to kind of make those connections easier and support the humans in healthcare. Um, and we also, we saw from the IPA that we had exposure to, that they had a fair amount of data, but it wasn't presented in an especially decipherable or actionable way, and there really wasn't much being done with the data other than communicating it to the providers and saying, hey, we need to do better. So we thought Protoqual would really focus on, well, what can you do? We know now, we have the diagnosis, but what steps can we take? Um, and one of the biggest steps we felt was that the people who are on the front lines of care, and Protoqual, by the way, focuses mostly at the moment in the ambulatory care setting. We're in exploration with a hospital system to begin to work with it with the hospital setting as well. And there's quite a lot of overlap, obviously, but we felt like the folks on the front lines were just not getting a lot of support. There are a lot of educational resources for leaders, and there's CME involving patient experience. There's great training, but not a lot of training available for staff, and especially recognizing the how tough it is to learn in a busy healthcare setting.
Mm-hmm.
The organization where we were investigating as a potential first site for Protoqual, their trainings for staff were like 45-minute PowerPoints with a voiceover, and it was just completely unrealistic to expect that someone who's working just to kind of stay afloat in an office is going to be able to consume that or internalize any of that. So we wanted to kind of recognize the realities of the medical setting. And then I guess the last thing is kind of bringing those things together, and that's what when I spoke with Denise, that we thought that this discussion would be about. And so Protoqual is also kind of working to help with alignment in an organization, and that could mean tracking many different things like educational interventions and other PX performance programs, but it could also mean just facilitating the sharing of data throughout the organization. So when a health system deploys Protoqual, we kind of map their whole organization and pull that into the system. And so when data is coming in, whether it's engagement data about education or PX data from surveys, everyone is seeing exactly what they need to see. An office is seeing their performance, a group is seeing all the offices within that group, even down to the provider level, and the organization is seeing the global picture. And so we're trying to find a way to make it easier for people to line up and break down some of these silos.
Alex, can I interrupt real quick?
Please, yeah.
So if an organization is using Press Ganey, you're helping to visualize some of that data?
Yeah, that's right. And that's a great question. That I think virtually every client that we work with has an existing data partner.
Mm-hmm.
So Protoqual is very much designed to complement other survey companies, and that could be, it could mean a lot of things. Some of the places where we work, they get quarterly surveys from a vendor. And so in those cases, they use Protoqual because our survey data is real time to get kind of a preview and to correlate that data with other survey information that's coming in, or to do like pulse surveys where they might ask a specific shorter set of questions to identify further an opportunity for improvement or something like that. So the Protoqual, we're happy to if people use our survey system, but we're equally happy if they have another vendor.
Excellent, thank you.
In its essence, we were just trying to help improve the understanding of patients and build skills in a way that's scalable. And so, I think one of the challenges we're trying to overcome is it's really difficult and expensive to get training distributed if it's live training, to get training distributed to a very large workforce. And so we're trying to use technology to scale that education and make it very easy as a leader to manage who's learning what. So I was telling Denise before we got on the call that our first sort of set of clients has really all been word of mouth and just referrals. So this is really one of the first times that we're talking to a group about Protoqual, and that made me really excited to have a chance to share that with you all. And some organizations we're allowed to talk about, and some we aren't. So large HCOs has to do for now. But I think the thing I wanted to share is that there are a lot of different types of healthcare entities that are finding that our approach is helpful. We have payers, but we also even have individual retail offices, and we're working with medical schools and IPAs, and so there's a wide range of client partners. And I think that's because the system is set up to be very flexible and configurable to meet the different needs of different organizations.
Mhm.
And we spend a lot of time at the beginning of a deployment really trying to understand how an organization is structured, and then how we can set things up to really make things as effective as they can be. And so far, this is also an exciting time for us because we started off with a pilot project in a healthcare organization not to be named, and then after a year, that the pilot was deemed successful, and we expanded into more groups within that organization. But now we're reaching the first time when independent CAP survey data is coming back to validate. Well, we're seeing scores improving within Protoqual, but is that reflected, on CAP scores? And we've seen that in engaged groups, we're getting about a 10% survey score improvement so far. And then there's a big online reputation management benefit as well, where health grade scores are up, and the volume of 5-star public reviews online are way up as well. So those are the metrics that we're seeing from our approach. And I feel like this is I created this slide specifically for this presentation to be, because I wanted to really show the process.
Mm.
And as you pointed out, survey data can come from a number of sources. We felt it was very important to have our own survey functionality within the system, because we need to measure everything to make sure it's improving. And there are a number of places where we work that need that functionality. But if survey data comes from somewhere else, we're very happy. And it can work just as effectively with our analytics system that can recommend education and interventions based on the data we are gathering. So generally what we do, although this is very configurable to the needs of the organization, generally what we do is we'll put an organization on like a fundamentals course while we're gathering our initial data. So this way we get learning going, weekly assignments, and we kind of start to get patient experience on the top of mind before we make any recommendations based on feedback that we're getting. And so that fundamentals course can be of different lengths, but usually we use a 50-week, 50-week course. And although we can configure that afterwards, we have a functionality in the system to make recommendations automatically about training based on the data we're seeing in the surveys. If performance drops in a certain area below a certain threshold, we can intervene with training. Or if there are particular areas that we want to target for improvement, we can intervene with training. And the training, in addition to being really bite-sized micro learning in a way that's kind of maximally time efficient and sort of respectful of the time of busy staff, everything in our system is gamified. And so we're tracking and rewarding participation in the system as well. And I'll show you a little bit of that both on a slide and in the demo. And then the nice thing about having these two things work together is that we're able to correlate, maybe not perfectly, but we're able to establish correlations between where we've intervened and then seeing the results on PX performance. So I think I'll just touch on a couple of the spots through that process, and then maybe get into a demo. So our patient feedback engine was really just designed to be maximally flexible, because the places we've worked so far have had such different philosophies. I wonder what the team that's on the call today feels about this. And we have some organizations that adhere very closely to CAPS, and they want their surveys that go out to look very much like CAPS. We have other organizations that have maybe a more progressive or a newer approach. They're interested in doing things like just show me a net promoter score and give them a place to comment, and then let Protoqual sort those comments so that they can learn just from what people are saying in free text. But regardless of how the surveys are constructed, when a patient submits a survey in Protoqual, that data is in the dashboard in real time. So you can look at, typically these are digitally initiated surveys. They happen at the time of visit. And we have a lot of different methodologies, because when we're getting surveys deployed in an office, we kind of want to match the workflow and see, what's the easiest way you're going to be able to collect data. Sometimes that's just integrating with their, patient communication portal or something like that. But we have, you can send text and email surveys within the system. And we have QR code posters and cards that we make available to offices. So we really try to match these practices or clinics' needs with how we deliver surveys. I think we have about 7 languages so far, but it's so easy to put a survey into the system that really the longest delay is getting a translation translated and then approved. So it's very easy to change surveys and implement new surveys in new languages, and they all aggregate within the system, which I'll show you. But you can also sort by survey if you want to see the results of a particular survey.
So
And go ahead, Denise.
a
I'm
couple
sorry.
questions. So of
Yeah.
course, I picked up my phone and looked at that QR code. So that was awesome to be able to do that. I'm curious about this on a couple questions. Alex, are you guys authorized CAPS providers?
We are not.
Not okay.
We no, and that's a great question, but we haven't taken that road because in part because there are very established and sophisticated companies performing that role, but also I think that our we were looking to provide a little bit of a different service with our surveys. We were looking to, well, in offices that needed it, or in practices or clinics, can we up the survey volume and make and make those results available in real time? So we were really trying to kind of create real-time actionable data coming in as a preview for CAPS, to give you kind of an advance notice, whether you're at the organization level, even down to the provider level, about what you can do, what are the opportunities to make some improvements before CAPS comes around again.
Okay. And then obviously when I scan a QR code, that anything I submit is anonymous. You're not you're not identifying to a patient.
That's right. The first couple of organizations that we deployed with, it was very important for them that Protoqual not collect, save, store, share any PHI. And so we've built the system to do that. So even in a situation in which an office is using text surveys to send a link out to their patients, Protoqual will never keep that information. And we even have AI technology implemented when there's free text information coming back. If there's something that's personally identifiable, we're able to scrub that so that we can, protect the anonymity of the survey respondents.
Excellent. Thanks, Alex.
Sure. And so that's the survey side, but I think that everyone at Protoqual agrees that at our heart, we're a learning company, and that what we use survey data for is to just make our learning more relevant and more helpful. And so we have built what I believe is the first purpose-built patient experience learning management system. And so we've kind of incorporated, not only things that are, beneficial for the PX universe, like the link between educational activities and CAPS categories, for example, but we've also brought in adult learning best practices. So, we have an element of kind of, a Netflix style video library and Duolingo style learning. And so we've tried to really make the system fun and rewarding, in its, and just enjoyable to use. All the Protoqual content is 5 minutes or less. But many of our clients just use the Protoqual content, and that's it. The system delivers it automatically every week. We kind of set that up ahead of time, and then there's no kind of worrying on Friday, like, oh my gosh, I've got to get 10,000 assignments out to my offices. The system handles all that. But we're also able to, it's very easy to add your own content as an organization and distribute that as well. And we're even partnering with some of our clients who have maybe a longer and not as exciting piece of content that they'd like us to jazz up, basically, and turn into a 3-minute animated video that's enjoyable to watch. So these things all kind of work together in our learning platform. And on the content side, we have about 100 pieces of content in our library now. We're hoping to double that in the year ahead. And we've kind of built an engine for how to generate this content. So we have a content advisory team that has physicians and patient experience experts experts in many different roles, people that are in leadership roles at healthcare organizations, but also folks that are running an office. And some of our best topics actually come from clients or even patients. Not long ago, we got a recommendation from a patient in one of the survey comments that said that they weren't happy with how their balance was collected. And collecting patient balances is, it can be a little bit of an awkward thing. And we thought, wow, what a great comment. And so we built an activity out of that. So once a topic is validated and identified, we have an Emmy-winning production team and animators all over the world who are helping us to bring these things to life. In the demo, if it's okay, I'll show you about a minute of one so you can kind of get a flavor for what they look like. And I've included some of the topics we cover here A lot of them are soft skills like empathy and teamwork, and so those things are of course very valuable. But we do get into some of the specifics of service recovery from a staff perspective, and things like cultural competence and meeting the unique needs of different types of patients. And so there are some more technical things as well. I guess the through line through all these topics is that we're trying to just make them hyper relevant to the staff, and particularly to administrative staff and clinical support staff. We have a track that we're developing that's specifically for physicians, and a track for leaders, but those are works in progress. And primarily at the moment, what we're delivering is frontline staff education, patient-facing staff education. And a thing that's happened fairly recently with Protoqual, this is functionality that we've added that has come directly from client requests, is we have the ability to gather data now, and then we're sharing education based on what we're learning in that data. And what we heard was, well, it would be great if we could also track other initiatives and share, not just training, but maybe there's a PX effort that we want to distribute to a certain group. Maybe they need to implement a third next available scheduling policy, or put something in their office to share with patients or something like that. So what we're incorporating is a way to assign these PX quality efforts in addition to education, and track them in the same hub. So it really, the goal is to not just integrate training with patient feedback, but to create a place where all your quality efforts can be related to patient experience can be tracked in a very time-saving and convenient way. And so that's the latest part of the functionality that's coming online. I was telling Denise, this is interesting timing because in July there's a big push of some new functionality that we're adding to Protoqual. I'm going to share with you just a little bit of some of the designs that what that new functionality will look like, but mostly we'll just be working in the existing system. And this is one of the features that's new that I'm excited to be able to share next month with our clients. This has, I think, possibly become the most important thing to many of our customers, and it's the most joyful to me, certainly, when I'm interacting with them. What we discovered in many of the places where we work is that there's a lot of communication with an office, and there's particularly a lot of communication with a provider, but individual staff members are not getting a lot of recognition for their hard work and for the things that they're doing every day to influence patient experience. And so Protoqual has done a lot to add that to our system, and also to just make their experience in the system rewarding. So there's gamification that's going on all the time in the system. You're earning things like crowns if you completed activity with 100% on the first try. We reward streaks if you stay current on your activities for a long time. And we have some people, bless their hearts, that have streaks of like 80 weeks wow. on the system, and they really have kind of made this a part of their lives. And so we have all these ways to reward people's participation, but we're also attaching to those things contests and leaderboards. And we know how sometimes a Starbucks card or a DoorDash lunch card for your office can really make a difference and feel like what you're doing is worthwhile. And we distribute a lot of those. It's one of my favorite calls to make to offices. And then this idea of staff shout outs came up about 6 months ago. We've gotten quite a lot of free text data now when patients are responding. And what we're able to do in the system is to sort that data by its kind of positive to negative polarity, or by the net promoter score of the person who's left that comment, and then use those positive comments to shout out specific staff within offices that are doing a great job. And so what now the organizations using Protoqual can do is every month share a report with every office that is automated and says, hey, these people got specifically recognized for the wonderful things they've done. And as I've spent more time in the PX universe, it's really been impressed upon me how important it is to really celebrate the hard work people are doing. And I feel like there's not enough of it, or there could always be more of it. I'll say it that way. And so we're really trying to facilitate that in an automated way for organizations to kind of get that positivity out there, and to kind of model some of the behaviors that we want in our interactions with patients. We also have a certificate program in patient experience. So office staff that spend 50 weeks on the system will get a certificate in the fundamentals of patient experience. And we do things like plant live trees in recognition of everyone who gets the certificate. We'll present them not only their certificate of completion, but also letting them proof that they've actually that there's been trees planted in their state as a result of their hard work. We do that because we did have some skeptical offices saying, "Hey, are these trees really being planted?" So we make sure to cover our bases on that. But we found that people really enjoy being able to track. Oh, well, my group, we've got 150 trees planted as a result of our group's work, or my office has 4 trees. So that's something we've added. And then, this is just tying it all together. And I think I'm about to go into the demo if it's okay. But what we're trying to do is create with that organizational mapping, visibility everywhere in the system. So you can compare groups within your organization, offices or practices or sites within your organization, even individual providers on all these metrics and track them over time. And so we've started to see that this has become a useful thing to integrate with performance plans because there's a sort of automated map of all the entities within a system that makes sharing and tracking these things very simple. Some people use the dashboards, which are updated in real time, but there are plenty of folks that just rely on an email report that comes on a cadence that they subscribe to, usually monthly. So we can do it either way. Tell me if anyone has any questions or comments before I jump into Protoqual. I'm happy to take some.
Yeah, I had a quick question on the QR codes. Like,
Sure.
are people really taking those? Are they because a lot of the time, you'll see, because it's expensive, right, to have all of those out there. What is like the best? Because when we ask patients to do surveys, I mean, it's not a bad idea actually to give them the card, but are people using it?
Yeah, I would say that our highest completion percentage, our greatest success, it comes from text links.
That's what I was going to say.
And so, but and so we're looking at probably about half. Text links, we generally get about 25% conversion rate on clicking a link and filling out the survey. On the QR codes, we're a little bit less sure because this is another sort of weakness of the QR codes, is that if someone hands someone a card or asks them to scan a poster, it's unclear. That's not really logged anywhere. But it seems to us like there's about a 15% or 10 to 15% success rate on handing out a card to the answer and filling out a survey. So they're a little bit less successful. There are some offices, what we found, or some sites. It's not just practices. It could be busy clinics where it was clear that their workflow was not going to allow some other mechanism for distributing surveys, and they didn't have a capability, whether through an EHR or a patient portal, where we could automate that. Protoqual does not interact with EHRs, and so this is a way that we can at least get some data going for these offices. So if we have a friendly sign and the cards out, and we train staff to hand the cards and request that the patients take a survey, we do get some data back, and so it's just bringing more offices into the fold. I think another thing that I've noticed about QR codes is that there's a younger skewing of the people filling them out. So I wonder if in the years ahead, will the QR code methodology become more successful? Right now, it feels like there's a group of seniors for whom this is just a little too much, and so it's an imperfect tool. We're just trying to kind of do everything we can to give a convenient way for offices to gather data. Okay, well, thank you for that. Can folks see the system?
I see it.
Okay, great. Well, I thought for the demo, I would start with a learner, and then I would show you some of the analytics that we have. And so, Protoqual sends emails. We use email notifications to send a friendly reminder that there's an assignment on Monday. If the past due date on Friday is drawing near, we'll send a heads up via email. But and I'm not going to show you the assignment emails, so I'll just stick to the platform. But a learner from an office staff can always just come into their assignments board, and this is where, if I'm a staff member and I log in, this is where I'm taken, and you can see the highlights of what you've done and what's assigned to you. But you can also see your schedule. And so we found that we implemented this in the not too distant past. We found that this is a very convenient way if folks know that they're going out of town, especially folks that are invested in the streaks. They can get some of their stuff done ahead of time. And so your stuff is always in the schedule. Every assignment is here for you. We do one assignment a week that can be configured, but I think that we found that sort of 5 minutes a week is a sweet spot for where it's hard to say you don't have time for that. And it can be kind of habituated in a way that gets you thinking about a patient experience topic every week. And that's kind of where we've landed, but we can alter these things as well. Protoqual, the system, automatically makes these assignments, sends these assignments out in the system, but it's also perfectly fine and easy for an administrator to go into management and assign a topic to their group or to their office as well. And if you click on, so that's one way. There's an assignment that comes in every week, but we also have all the activities available in an on-demand library. And what we do see a surprising amount of folks that are taking activities in here that are just seem to be of interest to them, and we have the library is searchable. So we've seen situations where like there was kind of a difficult encounter in an office, and so people will look up like, well, how do I handle questions or patients that pose challenges to me or something like that. So there are plenty of people that do sort of a self-guided exploration of the system as well. And maybe this is when I'll just show you, when you click on an activity, you're taken to an intro screen that gives you a quick bit of information about what the activity is going to be about. I chose this one because this is an example of one of those healthcare organizations. They're doing a blood pressure initiative that's going out to all the clinical support people in their organization. And so they're using Protoqual. They actually tasked us with creating this activity to kind of maximize the accuracy of blood pressure measurements. And we created it for them, and it's being spread wide throughout California in this organization. So let me just play a minute or so of this, and you can see what we're...
Taking a patient's vital signs may seem like one of the simplest parts of the office visit, but it's also one of the most important for your patient's good health. Today, we'll focus on blood pressure. It may surprise you to find out that at least 3 in 10 patients get false readings. In this video, we'll show you how to take blood pressure the right way. First, a quick refresher on why getting an accurate BP measurement is so important. There are no warning signs or symptoms for high blood pressure, one of the clearest indicators of risk for heart disease and stroke. A false low reading can convey a false sense of security, while an inaccurate high reading may lead to unnecessary medication. Providing proper patient instruction sets the stage for accurate BP readings. Remind patients not to eat, drink, or exercise for 30 minutes prior to their appointments and to empty their bladders beforehand. Have the patient sit in a comfortable chair with their back supported for at least 5 minutes before measuring their blood pressure. Make sure that patients keep both feet flat on the ground with legs uncrossed and that they
So that's kind of a feel for them. They're all animated in this way. They're all under 3 minutes because we want to leave a little time for a 5-question quiz. And when you have completed your video, you can jump right into that. They're multiple choice, and there are just 5 of them. We also include for every one of our activities a downloadable study guide, which I'm hoping the internet will allow me to. Yes, they're all just one page. And they cover, the points to pass the quiz for one thing and summarize the activity, but there are also some practical ways to kind of, put this into your daily work life. We found that some of the places where we deploy don't ever look at these, but many of them print them out, keep them in a binder, and use them as a handy reference. And while there's not one in this activity, there's the capability to share additional resources with every activity. So you can add web links or other PDF or Word files or things like that if you'd like to make those available to accompany your learning. We have, as the library has grown, one of the things we realized was, well, it's getting a little bit difficult for a learner to kind of grasp the full breadth of what we're offering. So we created the concept of skills. And skills are kind of buckets of activities that are related and allow you to, here's one on creating healing environments, for example, and that's about having the waiting room comfortable and how to make accessibility for people that have special needs, these types of things. So we've grouped all of our activities, and we'll continue to group these activities into skills. And you can see as a learner, well, what's your progress in completing a skill? And we do award badges for the completion of these skills that are tied to real life rewards too. And folks can also track their progress as they answer questions correctly and level up in the system. Their tree that they plant in Protoqual grows, and when that fully flowers is when we plant that full tree for them. And we have leaderboards that allow you to compare yourself to the other people in your office, and recommendations. So there are a lot of ways that we're always trying to encourage folks to stay in the system. But I think we also did try to create some reasonable limits to the fun in the system, because we don't want to take too much time away from the practice life. So that's the learner side. Oh, on the survey side, the surveys can be sent in the system here. You can send them via text or drag in an Excel file with a long list of contacts that Protoqual will then automatically distribute them to, and print your QR code posters there. So that's kind of the survey area. And I think maybe that's enough on the learners, but I wanted to just show you a little bit of what we're doing, what comes out of, oh, wait, I see a chat. Oh, okay, no problem, Kirk, thank you. So I wanted to show a little bit of the analytics that are coming in. So we have created dashboards that are, you'll recognize as similar to the CAP scores, in part because this is very configurable, but this is frequently how our partners request that we present the data. So in our dashboards, you can select your date range, but you can also filter by survey. You could identify a specific group within your organization and see and compare those. Down to offices and even providers. So there's really a way to drill deeply into the data and compare different entities, not just a global scores. That was really important to us. It was a need that wasn't met in the initial IPAs we were working at, where they kind of had scores for their group, but they really couldn't tell who were the superstars and who needs some extra support. Additionally, we have you can drill down into the data for each category and see responses to each of the questions. So if your category score is maybe not as high as you'd like, you can begin to identify what specific issues are contributing to that score. And then there are tools to compare the groups or offices within the organization. Oh, I think I might see another chat. Oh, that was you, Denise. I was trying to be responsive, but I'm over the top. And then I guess the final thing I'll show on this dashboard is that we do have free text analysis with automatic translation of the survey responses as they come in. When we send a survey out, the first thing that a person does when they click the link is to select the language they're most comfortable taking the survey in, and then all the questions are given in that language, and then their response is translated right here in Protoqual. For the benefit of folks that are interpreting the data. And we also, because we tag all these comments, we're able to sort what are the positive, what are the happy folks saying, and what are the not so happy folks saying, and that kind of gives us a way to kind of customize the recommendations for specific offices. I want to share, I know we're running a little bit tight on time, and so I wanted to just share one other report in the system and a couple of case studies. But there's also the monthly reports that go out, are a roll up of all the data that gets gathered in a system, both on the education engagement side and on the PX performance side. So we try to wrap those things in together, and the recommendation engine, delivers its training automatically in the background to eliminate that burden on administrators. Is there anything else anyone would like to see in the system before I just hit a couple more slides? Okay, great. Thank you all very much for your patience. And the last thing I really wanted to show was Protoqual in action. We just had a really interesting thing happen earlier this year, where which I think really demonstrates how the training and the data work together so nicely in Protoqual. A doctor in California went on the system. They did an impressive job, collected 116 surveys just in their first month for this one practice. And we noticed in the system that their access scores were it's sort of outlier low. We know it's always a challenge, right? Access, but that they were really struggling in that area. And when the system took a look at the comments that came in, we can develop these automated recommendation sheets based on all the comments, so that it's sort of easily digestible for the offices. We always want to include the things that the happy patients are saying. We think that's really important, but we also identified some things in this particular set of survey responses. One of the things is that when you call the office to schedule an appointment, there's a long message after which the voicemail box is full, so you can't leave a message, and it was causing a lot of frustration and difficulty getting patients scheduled. So this was a thing that the system was able to detect and recommend to this office, in addition to recognizing and celebrating what the office staff were doing well in that month. In the next month, about the same amount of surveys came in. A dramatic, and we did some training on phone etiquette and some other access metrics. a dramatic increase in performance on the surveys in the next month. And if we look at the comparison, a really remarkable improvement. Now, is this all related to Protoqual? Probably not. I think we think there's some benefit to kind of the sentinel effect that, you start to think about Protoqual, you start to think about patient experience, you know that you're requesting feedback from your patients, that all helps, but you're also getting training that's relevant to the issues that you maybe need a little support in. And this can make a dramatic difference in survey scores. And so that's kind of an example of Protoqual in action. So we've delivered more than 50,000 trainings already. And that's, when the trainings are only 5 minutes long and they're automated, you can really scale this in a meaningful way. And overwhelmingly positive responses to the training. We give a thumbs up, thumbs down question after every single activity. Did you find this helpful? And we get 99% so far that have found our content helpful. And just a few other kind of, I think, logistical things that I wanted to share. We don't have to deploy any software because the system works in web browsers. And thanks in part to what we learned during COVID, all the training is virtual. We don't need to come and bother a site with our visits or training. And it makes the onboarding really very scalable. We can have learners on in a matter of minutes once we get the information back about who's in a particular clinic or practice. As you asked earlier, Denise, we do not keep or send any PHI. And we have so far really had to have no interaction or disruption or consumption of IT resources in the organizations that we work in. So there isn't really much for them to do because we handle the onboarding of new staff and we assign them usernames and passwords. And so it really happens in a very convenient way. And I thank you all so very much for listening to all that. And I'd love to answer any questions if you have them.
Oh, Alex, thank you so much. And I have a list of questions, but I'm going to be quiet and see who else might have some questions.
I'm not very mean to question askers. I've discovered.
All right, Diane.
Yeah. So I think you've already answered my question, but I just want to verify and validate. So there's no integration into other like learning management systems or anything like that for healthcare organizations?
So if in this situation you have an LMS that you're using already, is that right?
Yes.
So what happens in that situation? That's a great question. What we do view the Protoqual system as modular, and so there are some situations in which an organization with an existing LMS licenses the content alone. So they'll license the content library and then deliver it through their learning platform. So that's something we can absolutely talk about. Yep.
Okay.
And that would be a very, very different cost, as you can imagine.
Right. Yeah. And that would take up some IT resources and things of that nature as well. So.
Right.
Yeah.
But if you have a way to get the content out, we love it. We want you to be able to share that with the folks on your team.
Gotcha.
And I think I may have touched on this for a minute before, but if when we're working with someone, if they have a request for a topic, and we can, provided that we can make that video available to the entire community of learners, we don't charge anything for that topic. So we have plenty of partners that are using us to help them build sort of their own library at no cost other than the subscription to the service.
Okay. Fantastic. Thank you.
Sure. Thank you.
So I have a couple different questions, Alex.
Okay.
You mentioned early on that an example of like a 50-week program. And I'm curious how you manage as new employees on board. Do they have to go back and do the prior trainings, or how is that managed?
Yeah, so that's a great question, and we're somewhat flexible in the way we handle this, in part because we've had very conflicting requests about how to handle this from our clients. We've had some practices and groups that want everyone, if you start and you're 30 weeks behind, you better catch up within a couple of weeks. So the system will allow that to happen. That's not our preferred way. So the system does automate bringing regardless of when they begin, their assignment track happens on their schedule. We can adjust that for special requests, but they would go on a weekly system. And actually, I think what we're moving towards is starting with a smaller sort of onboarding track, and then moving to everyone in the office receiving the same training weekly, so that it's something that we can integrate with huddles and things like that. So I think that that's sort of the future of how we're planning to train. And then we would have some, within a month, you would have maybe some best practices that you'd be training on, but then you'd also have some specific, these are relevant to your particular data. So we have some specific opportunities to improve, some best practices to share, and that would all happen in a shared experience for the learners within an office. I don't know what the group thinks. I think that for the learning experts that we talked to, that seemed like the best possible way. And we're also integrating things like spaced repetition too. So you will we are re-delivering some content periodically to try to help with retention as well.
Excellent. So I heard you say that it's delivered via email. I think I had written a question. Is it delivered via text or email? So the trainings, if it drops to an employee's phone,
yes,
or
all our notification happens by email.
Okay.
And so that seemed to be the most kind of widely applicable. But we, there are some offices, as you know, that they do not have work emails, and the system works in that regard too. They'll have usernames and passwords. They can access all their training on the system, but in a way, it's kind of an independent practice that's affiliated with an IPA or a group. It kind of helps to bring them into the kind of collective fold. But an email is not required, but that's generally how we notify.
Okay. Then you teased it, but I didn't get to ask. I purposely didn't ask questions at the time because I would have taken all of your time. But you said managing patient experience quality efforts. That's a new feature. I'm so curious about that. Can you tell a little bit more?
Yes. So this is, I'm really excited about this. What's happening, the genesis of this is that, thank you, Crystal. The genesis of this is that one of the organizations where they're using Protoqual to deliver training to a very large organization with like 16 groups. And so, well, I guess in healthcare, even 16 groups is not incredibly large, but it's large to me. And so the system has made the management of the education assignments much easier than any kind of efforts that they've done in the past. So what they requested is, well, can we assign, if we have a performance improvement related initiative, can we assign that to the offices in the same way that we assign education? And so the new functionality that we're bringing on this coming month will allow you as an organization to log those performance improvements and create a list that you can assign. And then the organizations will, the offices or practices or whatever entities that you assign them to, they can then attest to completing these initiatives, and they can be scored on a leaderboard just like education performance. So there'll be kind of a global leaderboard of offices, practices, clinics within the organization that's based on the amount of training they've completed, whether they've completed the assignments that these initiatives that they've been assigned, which we're thinking about calling quests, but I'm not sure yet. And so this would all be centralized in one place. And the other thing that's nice about it is that then they'll have a repository of all the support materials. So if there are, posters that you need to put up as part of one of these initiatives, that poster can be downloaded and printed directly from Protoqual. So there's no, emailing or management of these things amongst this vast number of offices. So this is something that I will have to come and talk to you about next time.
Excellent. And then along with that, I'm really curious, do you have data correlating? So in this clinic, they've completed whatever percentage of the trainings, et cetera, and correlating to their data and being able to compare that this other clinic has completed fewer of the trainings and their data. So to be able to show some of that correlational information.
Yes, that's I think the real one of the most powerful capabilities in the system is, and it's useful for us too, because we really need to be able to see, like, are these interventions effective? But that's precisely what you can do in Protoqual, is to be able to see, well, what kind of engagement are we getting from our healthcare teams, and what kind of changes over time are we seeing in scores, and how might we adjust those?
Excellent. And I just looked at the clock and I have more questions, but I'll hold those for for after. But I've let us go over, and I'm so sorry. And hopefully everybody who's still with us had intended to stay over with us and join speed networking. But just in case not, I'll do a quick thank you to Alex for the content you've shared. So excited about what you and your team are creating and what you were able to share with us today. I will ensure that the video goes out to everybody who joined us today, as well as everybody who registered. It'll also be within the PX community's digital space for access by others in the future. And Alex, I'll make sure that they have your contact information so they can reach out for further information.
I'm grateful to everyone for visiting with me, and thanks so much, Denise, for setting this up.
Oh, you're welcome. So now we're transitioning to speed networking, and